All right, welcome everyone. I'm Laurie Ledley, the founder and president of Valley Sleep Therapy and Valley Sleep Center. Said that backwards, usually it's center and then therapy. We are so excited to have Dr. Sue Ellen Carpenter from Atlanta, Georgia, join us today. We're talking about fertility and sleep, and I just want to give you her the proper introduction here. Dr. Carpenter is an MD, and she joins us all the way from Atlanta, Georgia, Bloom Fertility. She has over 30 years experience in reproductive medicine. Her specialties include in vitro fertilization, treating congenital abnormalities associated with infertility, as well as endometriosis, polycystic ovarian syndrome. Dr. Carpenter, please tell us a little bit about yourself, why you've chosen fertility treatment, and welcome to our webinar. Thank you so much for being willing to talk about this very interesting subject.
Thank you, Laurie. I chose infertility actually 30 some years ago. I was already an OBGYN and I was training right at the beginning of in vitro fertilization. The first in vitro fertilization babies in the world were born while I was in training, and I was at Johns Hopkins, which had a strong relationship to the real trailblazers in our field in America. The Dr. Howard and Georgiana Jones, a married couple who founded the clinic in Norfolk and had the first American IVF babies. And it was a really exciting time. And I'm just passionate about helping people build their families. The reason that I founded Bloom was to try to offer some options to patients, particularly those who've been priced out of the IVF market for a long time. In 17 states in the country, we actually have mandated insurance coverage for fertility care, but for other patients, it's a cash proposition, and traditional IVF has become more and more sophisticated, but ultimately now costs about $20,000 or $25,000 a cycle.
Wow.
I had the opportunity, and I don't know if you can see this, to start an Invo Center. And the point of the Invo Center is that we use this little device. It's only about 1.5 inches long and 1 inch wide. It's called an InvoCell. And instead of embryos growing in an IVF laboratory, they grow in the InvoCell. They live in this little conical device with some media. And then we put that in this cylinder to protect it, keep it sterilized. And we place this actually in the patient's vagina for 5 days. And it's really sort of a miracle that body temperature, the pH of a woman's body, all of the right carbon dioxide and nitrate levels are maintained within this in the vagina. And then after 5 days, we remove it and identify the embryos and very, very gently place them back into the uterine cavity. And it has the same success rate as traditional IVF. So it's a chapter in my life to be able to offer something new, a little less technical, which I think appeals to people, and much less expensive. So
fascinating.
Fertility does.
All right, I'm going to share my screen so we can talk about sleep. So hopefully my dog doesn't bark. Can you see this okay?
I can.
Okay. All right. Here we go. Let's see. Slideshow. All right. There you are.
That's great. So we've talked about this. I think we can go to the next slide. And I've talked about what an Invo Center is and how fertility treatment has been reimagined by Invo Bioscience. They're the manufacturers of the InvoCell. And we could move on. And I admitted to Laurie, when I started reading about this, I haven't given a moment's thought, honestly, to sleep and infertility. And I was a little bit horrified. I have a review of systems that patients answer, every new patient does. 35 questions of things that might be affecting them, and not one of them pertains to sleep. So preparing for this is going to change the way I practice as well.
Yeah, so we talked a little bit about that, and I'm so excited that we did come up, because I also thought, okay, is this a subject that people would be interested in? And I'm just like, sleep affects everything. So I'm so glad that you have done your research, and why isn't this going forward? Because I'm on there we go. All right.
There we go. So I think most women understand that hormones produced by the ovary play an important role in reproduction. But ovarian hormones are controlled by the brain. And if you're able to move forward one more, Lori, we might be able to talk about how sleep might affect reproduction. So toward the bottom of this cascade is the ovary. It serves two primary functions, I would say. In this setting, it's going to produce the hormones estrogen and progesterone. Those serve the purpose of preparing the uterus for an embryo to implant, and the ovary also releases the egg. But what you might not know is that everything the ovary does is controlled by the hypothalamus and pituitary. Those are glands that sit at the base of the brain. And so up at the top here, neurotransmitters, which are brain chemicals, stress hormones, the hormone melatonin, all impact and interact with the hypothalamus. Now, admittedly, we're not great at knowing exactly all the mechanisms, but suffice it to say, it's easy to imagine that sleep, which impacts the brain so tremendously, would have an effect on the hypothalamus. And one of the dramatic things about the hypothalamus is it has to pulse this hormone GnRH. It stands for gonadotropin releasing hormone. It's a very short-acting molecule, and it has to pulse every 90 minutes to be effective. So anything that interferes with that will interrupt the menstrual cycle. When it's working correctly, GnRH pulses and causes the pituitary to make FSH and LH, which impact the ovary directly. And then the pituitary also makes thyroid hormone and prolactin, which impact the ovarian cycle less directly. But I hope that this little diagram helps you to understand how sleep might affect the ovarian cycle.
Well, and it's so interesting because you're probably all thinking, like, what could happen that would interrupt that 90-second GnRH cycle? And I can tell you that that brain needs to sleep all night. Otherwise, all these things are interrupted, right? And so what kinds of things would happen in the brain where it would interrupt it? Think about snoring. Think about a bed partner that's snoring, a dog, a cat, a child. So if that brain isn't plugged in all night uninterrupted, it doesn't get a full charge. So it would affect this whole system. And I love your diagram, by the way. Dr. Carpenter came up with this, and Jackie helped us make it look like it's beautiful. I love it. You're definitely gonna, like you said, hang it on your refrigerator, make a book. All right. So tell us about the Inva Center is yeah. So I learned something myself. The little Inva cell that lives inside a woman's vagina, growing your baby. That is so fascinating. I love that. So that's what you do. You're not storing eggs in some lab. They're being made inside them.
That's right. That's right.
Awesome.
And I do traditional office infertility as well. So I do a whole lot of evaluating the menstrual cycle, coaching patients about timing of ovulation, office treatment, which is what we call using ovulation medication, doing artificial insemination. But when patients get to the threshold of needing in vitro fertilization, the InvaCell offers a whole new choice in that regard that is
so cool,
more intimate, and more accessible to so many people. It just doesn't require the amount of medication, which is something we have not actually, you and I haven't talked about, but just in the course of an IVF cycle, we use so much medication, even in regular office ovulation medication. All of it changes mood, hormones. Some of them cause hot flashes. Treatment may interfere with sleep as much as sleep might interfere with fertility and treatment. And then here it talks about sleep deprivation that might cause the body to produce more stress hormones. And we know that that's not great for your overall health and can throw off all of your hormone levels.
It's like running a marathon all night, right? If your brain is being interrupted all night constantly, for example, snoring or listening to someone snore, it's literally creating cortisol, like if you're running a race. So imagine, I mean, I don't want to run a marathon ever, not much less all night, every night. Oh, fantastic. Are you ready for the next slide?
I think so.
Yeah. Yeah. So what other areas of concern can you think of?
A whole series of things came up when I started researching this. Shift work, which is really common for, I would say, for women in particular, but I think both genders. And, you know, I've always known on the most rudimentary level that shift work was a problem for couples because it interferes with intimacy. But I was really wondering if I could get you, Lori, to say how you advise patients who are having sleep disorders because of their career obligations.
Well, I'll definitely tell you, and then I'll tell you a funny story that I thought of after we talked yesterday. My husband and I have always worked shift work. I'm a respiratory therapist, sleep technologist. I watched people sleep on night shift. That was my shift. And we laughed because I had Kaylee, and then Colton I show up pregnant when Kaylee's like 8 months old, and literally it was kind of like, who's the father? Because like we were constantly like passing, you know, it's like it only takes one time.
That's right.
So that was pretty funny that, you know, he was like, who's the father? Because we were working different shifts. And so my advice, if you are working a night shift or a shift worker, is try to stick on that same schedule. Like go to bed at the same time, wake up at the same time. If you're getting off, you know, right now, if you're getting off at, you know, 6:30 or 7, it's still dark out if you're in Arizona, which is great. Keep your sunglasses on till you can keep it dark until you can get home and, you know, get your kids off to school, whatever, you know, get into bed, but try to keep that same schedule. Try to work your 3 shifts in a row. Don't skip a day. I usually shift workers work 12-hour shifts and they're usually in a row. You know, Glenn used to work, he'd do 6 in a row. So he'd have 3 at one week and 3 at the other, just to kind of keep his body circadian rhythm sort of in check. And then when you do wake up, get a lot of light and make sure you wake up at the same time. If you struggle with not being able to get that 7 to 9 hours during the day, then do the caffeine nap. This is a great idea where you just, you know, you chug 6 ounces of caffeine and then lay down right away for 30 minutes, set your alarm right before your shift, before you have to go. That'll kind of give you a little burst. You know, you'll rest and then your caffeine will kick in by the time you wake up. And then as far as shift workers and fertility, you have to schedule the time together so that, you know, you're going to know your cycle, you're going to know your schedules, you know, get together and just say, okay, this is our date, time, our intimate time, whatever, just plan it. And that way it can happen and hopefully help out with your infertility. But again, just really make sure you get that sleep that you need if you're working the night shift. All right.
That's great advice. Another thing that came up as we were talking this over was about melatonin.
Oh, right.
Melatonin, too much melatonin can interfere with the hypothalamic pituitary ovarian axis that we showed. So my understanding is that the appropriate dose is 3 milligrams, and melatonin is sold in a lot of other denominations. And so I fear people getting the wrong thing. And then another interesting point about it is that melatonin is recommended for egg quality, both in patients who are older or having issues with ovarian reserve and in the setting of PCOS. So I was curious about sort of your recommendations for the proper use of melatonin with regard to sleep, knowing that the right doses can be helpful for eggs. Uh-oh.
Sorry, my dog was barking.
I know. I understand. Can you go back a couple slides though?
Yeah, sure. Let's see here. Well, let me go back. Yeah. Right here. Oh, sorry about that.
Here we are. This is
okay.
So I don't know if you can speak yet,
yeah.
But just we're
talking
about
melatonin is also an anti-inflammatory. I just learned that myself. And I think the mistake that people make is they either take too much and they take it too late in the day. So I liked your recommendation of the 3 milligrams, and take it even like a dinner time, because it takes a while to get into your system and working. But yeah, that can be something that can help with your sleep and your fertility. Yeah, definitely. I took it every single day, all during COVID, because I felt like it was, my doctor taught me that it was a way to prevent yourself from getting COVID. So, and I ended up getting COVID anyway, but but it's okay. I'm here. It's all good. I'm here. All right.
Another thing that we wanted to maybe talk about was polycystic ovarian syndrome, which is super common. I mean, ovulatory disorders are more than 50% of all the infertility diagnoses, and probably a third of all the ovulatory disorders are associated with PCOS. And preparing for this, I read that sleep disorders can cause glucose dysregulation, and some proportion of women with PCOS already have glucose dysregulation. And then actually I read that a study saying that women with PCOS had more sleep disorders, even when corrected for weight and age, than women without PCOS. So it's gotten me kind of turned on to specifically address this issue with that group of patients.
Yeah, really important that if you do have PCOS, come in and see us at Valley Sleep Center, get a consult, get a sleep study. Let's follow up, because if you do have sleep apnea or another underlying sleep disorder, it's definitely, not going to help your whole situation. Like that brain and getting that restorative sleep is really, really important. So great point.
Okay. And then to the extent that I had thought about sleep and infertility, there's a lot of fear, depression, and anxiety that comes about: fear of not getting pregnant, fear of painful procedures, sadness at not getting pregnant, anxiety about going on and on. You were likening sleep disorders to running a marathon all night with cortisol levels, and we often liken fertility treatment to a roller coaster where, every week patients' positive things happen and they're so up, and and it is trying to level that out a little bit. The terrors of each menstrual cycle is something we talk about a lot. So I can see where all of this would affect sleep. And I think we don't do the best job, but we try really hard to have resources for counseling and for support groups for fertility patients, knowing that these are really common symptoms.
Well, and another point that I want to let everyone know is that if you do have an underlying sleep disorder like sleep apnea, it will cause this depression and anxiety, and just this it just is this really bad cycle, right? So treat the sleep disorder, then the depression, the anxiety should get better, because your brain, again, is getting plugged in and charged and restored all night, every night once it's treated.
And then, again, this has been so financially trying for people.
Yeah.
And undoubtedly there's some insomnia related to that. Will I be able to afford to keep going if this treatment that I'm doing right now is unsuccessful? So it's a lot of pressure.
I have a little tip for all of you out there that are struggling with insomnia, especially if it's related to fertility. And I recommend using like imagery and working on your breath and focusing on your breath. And so, if you're laying there and your mind is going and you're thinking about all this financial concern about, one of the things you can do is just close your eyes and focus on your breath and imagine yourself in a really beautiful place. Imagine yourself holding your child that's not here yet, and what that would be like, just in a situation that just is really joyful to you, and you'll probably doze back off. So insomnia literally means the inability to escape our own thoughts. I'm
Ah,
like,
I didn't know
I
that.
have this. I've been having it really bad lately. I know exactly what to do, but I still, for the past week, have woke up at 3:30 in the morning, and I have to practice this regularly myself, and it works. So just remember, the only reason you can't fall asleep is because your own brain won't shut off. So use imagery, focus on your breath. Your breath is very rhythmic, kind of like the ocean. So if you like the ocean, imagine the ocean. Some people like rainforest. Some people love to play golf. I usually tell them you probably won't make it to the second hole. So yeah, good tips. All right. Advice, encouragement.
Yeah. So it's always hopeful. And sometimes it just feels like this will never end. The sadness will never end. But it does. And advice wise, I think that you need to remember to just be good to yourself, and whatever that means to you, and in terms of being good to your partner as well. That's what I ask patients to focus on. They get a lot of input from friends and relatives who are well-meaning, often to the tune of just go on vacation and everything will be fine, or just forget about it and everything will be fine. Um, None of which turns out to be terribly constructive. So there's a lot that can be done to help patients. We have a lot of great treatment strategies, and so seeking out care is always going to be your best option.
So great. So this is how we get a hold of you. Tell us
Yeah.
a little bit about, you're in Atlanta, but you do telemedicine, and we can get on a plane to Atlanta from Phoenix easy, right? We're there in what, 3 hours?
Yeah, probably less. Yes, I do a lot of telemedicine, and it's been great. I didn't do it before the pandemic, but Atlanta does have we have major traffic issues. The place is closed down today, to celebrate the Braves. 1 million people clogged
Oh,
downtown and
fun.
on out to the suburb for the parade. No one could get around today. Schools were closed. It was a whole celebration. But even on a regular day, traffic is an issue here. And I just found that once I got used to doing Zoom calls, patients are so much more relaxed in their own home. And they pushed back a little to start with, right? People said, oh, I don't want to do it that way. I need to touch you. And the getting there, the parking, the finding the office, the worrying about what they needed to do next and why were they like, it's just been great to have them be home and relaxed and talking online. And one of the things about the InVicell, when it comes, traditional in vitro fertilization actually requires about 7 to 8 doctor visits per cycle. And
Oh, interesting.
InVicell is half of that.
Oh, nice.
So there really are advantages for people who might want to come from out of town. They can get initial visits at home and come to Atlanta for a much shorter period of time to complete care. than you would in a traditional cycle. And it's been, I mean, long distance people have done, they've done it to save money over distance. And then also just the state of Georgia is one of the, it's geographically the largest landmass state east of the Mississippi River. Fun facts, right? So you can be in Georgia and be 5 hours away. And the fact that we can do InVicell with so many fewer visits is a big, important step.
That's awesome. Anything else that you want to add? Let's stop sharing and come over to our participants and see if anybody has a question. So you can chat right there. Go ahead and turn this off. Stop recording.